Assalamu alaikum. My name is Aisha Javed and I am a sociologist and a lecturer in LGS University campus. The topic which I have selected for today's lecture is health from the guide Contemporary Sociology in Global Age. The selection of the topic is based on the ongoing global health crisis that is caused by COVID-19. And as we all know that this COVID-19 has a very strong and a very pervasive impact on our global health, as well as this pandemic is not only affecting our biologies and our physiology, rather it has a very strong impact on our psychological and mental well-being. This pandemic is going to leave marks on our mind and imagination for at least one generation. The medical crisis and the spread of the virus can be countered through social mechanisms rather than medical efforts. And these social mechanisms include lockdown, social distancing, and social isolation. It is more than a crisis, and it is a social, human, and economic crisis. So that's why I have selected this topic because of the contemporary importance of this topic. Let's move on to the slides. Uh, Sociology of health and illness. For sociology, health is basically an issue which is not just limited to biological and physiological phenomena, rather, it is including social as well as the cultural dynamics of health into it. If we talk about the definitions of health in sociology, then different sociologists have given many definitions of health, but all of these definitions are categorized into the following four categories. Number one is health as the absence of illness. Number two is disease as deviance. And number three is health as balance. And the fourth one is health as function. So if we talk about health as the absence of illness, then it is, a very common realization in sociologists that health and illness, they both are two opposite things and they cannot go together. These definitions were very much popular in the 20th century, and they simply see both of these things as opposites, and health is seen something which is related to the absence of illness. If somebody is healthy, they are not ill, and if somebody is ill, they must not be called healthy. So, in medical professions, illness, specifically long term illness, is considered to lead to biological disadvantages while reducing individual lifespans and fertility. And without illness is seen as a normal human condition. So, the first definition is very simple, it is very straightforward, and it says that if there is illness, then that person should not be called as healthy, and if somebody is healthy, it means that this is a pure absence of illness. So let's move on to the second definition. Illness is a form of deviance. For understanding whether illness is a form of deviance, we must know what deviance is. Deviance is basically when we go against the cultural and the social norms. Deviance is non-conformity to the normative orientation of society. So in the second definition, it is said that illness is a form of deviance, and it requires monitoring and legitimization to prevent disruption of the society. For these definitions, it is important that to carry on the normal activities of the life, people should be healthy and they should be productive within their throughout their lifespan. But if somebody gets ill or somebody gets sick, then it means that they are deviating from their normal productive patterns of the life that can have repercussions for the society as well as for the economy. And according to this definition, complete lack of illness is a norm. Like health is basically something which is seen as the normative pattern of the society. Healthy body is seen as fulfilling all the normative expectations which are held by the society, and this definition says that health is basically the norm, and illness is basically a deviant behavior, and it is something which is problematic for the society. But these definitions also come with certain problems and certain flaws. So the flaw of this definition is that today a great number of the people are having chronic illnesses like blood pressures, like heart diseases, like maybe diabetes, but they are leading normal life. So they are not seen as deviants within the society, and they are not disrupting the normal productive patterns of the society, and they are behaving like productive and normal constructive human beings of the society. So this is how these kinds of definitions are also criticized. Now we'll come to the third kind of definition, that is health as balance. If we talk about health as balance, then it is seen that health is basically a sort of a balance between human organism and their environment. And as long as that balance is maintained, the body remains healthy. But unhealthy body or illness is the result of imbalance between human organism and their external environment. So one of the example of that is the work-life imbalance. Work-life imbalance is also a very good example of the imbalance between human organism and their external environment. And this work-life balance can cause illness, can cause health issues, stress, depression, and other biological problems. These definitions also take the human body as a system which maintains homeostatic condition within it. A homeostatic condition is basically a condition in which when a human body is attacked by any external thing or any external entity like a bacteria, like a virus, then it triggers its immune system, and ultimately the body becomes balances the equilibrium, and it treats the germ itself, and it maintains its healthy condition, which is related with the homeostatic human we can say quality, the homeostatic quality of human body. Okay, now these definitions are also criticized, and one of the possible, we can say, criticism and the major criticism over these definitions is that there is no universal definition of health as balance. And health as balance, or we can also say that what is the what is the definition of health as balance may vary from person to person. And if we talk about another criticism on these definitions, which include health as balance, then there can be subjective dimension of definitions. Maybe something which is taken subjectively by a person as healthy, or some condition which is taken by a person as a balance between his body and the environment, can be actually very detrimental to his or her health. So this is the problem with these kinds of definitions, and the subjective dimensions of the understanding that is based on humans' own definition can have a strong influence on their health, and maybe something which they are considering as healthy is actually, and we can say more biologically, that is unhealthy for human body. So the last one is health as function. When we talk about health as function, this is very simple, that a healthy body is functional, and the healthy body is basically able to carry out its normal daily activities and normal tasks. So if individuals are able to perform their functions, they perform their productive activities and their daily tasks within the society, for example, good living, satisfying social life, and an enjoyable leisure time, then we can say that they are healthy. But the loss of this functional ability due to illness or injury can be seen as a suffering at the end of the society as well as the individual. And this situation is related with illness, that when humans are not able to perform their functions within the society, then it looks like they are ill, and they are not having a healthy life. It is also difficult to set down any universal concept of health based on functional ability, and people live a very different lives and perform very different ranges of activities, because people can have many subjective definitions of health, as health as a functional ability, because what is function for one person can be a dysfunction for another person. So this is the problem with these kinds of definitions. And the functional definitions of health are also criticized by disabled people, who can be healthy, but as long as they do not fulfill this criteria of the functional definition of health, so they are taken as ill or sick. Now, attempts were made to design a more holistic definition, and this more holistic and more inclusive definition of health was given by WHO in 1946. And according to this definition, health is basically a state of complete physical, mental, and social well being, and not merely the absence of disease and infirmity. So, This is a kind of a definition which is more inclusive, and it is a holistic definition that is basically including all the previous dimensions of different definitions. But this definition is also seen a very utopian and a very idealized version of health. And it fails to compare health across different social groups and different societies, different cultures, different contexts, and different nations across the world. So, in spite of all these definitions, the problems only definitional problems, sorry, we are focusing on the biomedical model of health, which is basically a more sophisticated, a more scientific, and a more modern way to define and explain health. Biomedical model of health is basically the modern scientific model of health system, which is based on science, logic, as well as rational approach, and that is based on the experimental and scientific evidence. And this model is a kind of a health model which is opposite and completely against the alternative medical system or the complementary medical or medicine system. If we define this biomedical model of health, then the definition of this biomedical model of health is that it is the application of science to medical diagnosis and cure. And this model says that disease must be defined objectively in terms of identifiable signs located in the body as opposed to mere symptoms experienced by patients. So this model, it focuses on the scientific evidence in human body rather than focusing on their subjective feelings. It doesn't give any importance to the subjective feelings of patients when they are ill, but it focuses on the objective dimension of the scientific tests and the results, as well as the medical diagnosis. So this is our scientific biomedical model of health, which is basically scientific and rational in its nature. Okay, when we talk about the development of this model, then we must go through the history of different societies and how this model emerged. If we talk about the history, then prior to industrial revolution, there were two main agents which were involved in the care of unwell people: family and practitioners. Now, these practitioners were basically religious healers, and they simply used magical and religious healing strategies in order to deal with the illness and to treat people. And some of these traditional systems are nowadays called the alternative medicine system or the complementary medicine system, or we can say the traditional medicine system. So these are basically they used to exist earlier in the history. Over the past 2 centuries, the modern and the Western understanding of health has converted into biomedical model of health, which is a more sophisticated as well as a more scientific and a complex system that is related to our health institution. Modernity and biomedical model of health are intertwined. How they are intertwined? Because this biomedical model of health is based on scientific and rational understandings. It is not based on faith and blind trust. Rather, if we talk about the previous model or the alternative or the traditional model of healthcare system, then they were based on faith and they were based on traditions, religion, as well as different magical remedies and treatments. So this model developed when reason and science replaced faith and tradition, and as well as religion, and it is based on knowledge and science. When states used this model, uh, uh, and they intervened the health of the whole group of people. This gave birth to public health policy. It means that basically there were two major changes in healthcare system, and these two major changes are related with the rise of industrialization and the formation of nation state. When these two changes took place, people who were basically the inhabitants of certain territorial area, they became population and they became the citizens of that particular state, and that state took their population as a major resource for the development and their economic progress. That's how they shifted their attention on the health care system of that population, because that population was taken as one of the major mean of their economic development, major mean of their prosperity and their overall economic growth. So states started taking interest in the health of their people by using the biomedical model of health. If you look at the non-industrial societies previously, if we look at the development of this model, then in the history, the non-industrial societies, they use traditional medicines and treatments and different healing strategies in order to treat people from illness. It was passed on to the next generation through apprenticeship, and often it involves spiritual dimensions of treatment. Ill health was seen something that is related to bad spirit, evil eye, black magic, and sometimes it was seen as the result of somebody's sin or curse on that person. And rural people and the townspeople had no big authority than their own local healers, and so these healers, they used to treat them and they used to take care of their health. And this was basically the era in which health was taken as a personal problem. It was not a public issue, it was a personal problem. But later on, after industrialization and the rise of the nation state, the democratic boundaries and the people living in those boundaries and their identities were redefined, and they were treated as citizens. And the national population, the citizens as well as the national population, which became a national resource, and it was treated like a wealth of the nation, because they incorporated and they participated in the economic development, in productivity, in the prosperity of the state. And that's why the state started taking more importance, and the state started giving more importance to the population and to the health of the population, basically by launching the policies related with the health. A new science of population was developed, which was called demography at that time. And demography is basically the scientific study of human population dynamics, and it focused on the size of the population, the constitution of the population, as well as different elements of population related to their morbidity rate, their death rates, the birth rate, the marriage rate, so life longevity, their diet patterns. All these things were basically the part of this new science of demography, which is the sociology of population. So that's how states started taking interest, and demography became more a kind of a scientific discipline which was used by the state in order to keep records of their population. And in UK, for example, the census started in the start of the 19th century. It was repeated after every 10 years. And the records were kept regarding the death rates, the birth rates, marriage, suicide rates, illness rates, life expectancy. So all the records were kept in the form of data. And according to Michael Foucault, this practice, which was done by the state, was taken as a more monitoring strategy, or as a strategy of surveillance, or a strategy that was used to regulate population and to control and monitor the population. Michael Foucault also used that, also stated, and he used the public health in order to clarify that. Michael Foucault basically said that this public health policy is used to cleanse the social body of the population. So he said that this strategy, which is by the title public health policy, is a surveillance strategy, is a monitoring strategy which is used by the state in order to keep in order and to keep a check on the population in a very unobservable way, in a very unexposed way. So state took the responsibility for improving the conditions of its population in large-scale public projects like sanitation, water distribution, road paving, improvements to housing, and then food processing and slaughterhouses were also monitored, and the hygiene standards were also monitored. So burial practices started taking place, and all these strategies were basically the part of that public health policy that was launched by the state to monitor their population's demographic dimension. Institutions like schools, hospitals, and workhouses, prisons, and asylums, they came about as a part of policing by the state. Michael Foucault, history of public health also involves shift towards supervised social world as healthy one. So he said that basically, whenever the state is supervising the population, then the population is obviously healthy. So this was the common norm and common understanding in the masses regarding this public health policy. However, this medical model has changed in the past, and the new model placed individual at the center rather than health at the center, because individuals, this model again changed in the last few years, and now again importance is placed in the individual, and individuals are taken like the center of attention, and now health is no more the responsibility of the state, rather it is a personal responsibility of citizens. And they must take care of their health, and they must use different health preventive or disease preventive strategies in order to keep themselves healthy. And self-care basically involves life care choices that are focused on illness prevention. So again, the shift of the responsibility was from the state back to the individual, and individual were basically the center of attention in order to take care of their own health, and this became the responsibility of the citizens rather than the state. So that's how the responsibility shifted back to the individuals. According to Peterson and Lupton 2000, political discourses are generated that place responsibility on the citizens to look after themselves. The modern healthcare system is strongly influenced by scientific research for diagnosis and treatment. Disease is defined as an objective physical condition which is observable through symptoms. So we are now coming back to the biomedical model of health, and we have defined that this is basically a model which is more objective in its nature, and it is basically based on physical evidence, and those evidence which are more observable through symptoms. Symptoms are external signs of disease that can be read by trained experts. Whereas before this model of health, symptoms were previously experienced as subjective suffering. So this model is more scientific, more rational in its approach, and it looks at the body as an object, and it looks at the personal and subjective feelings of individual as unimportant. So according to this model of health, crime, homosexuality, and other abnormal practices could be reformed and could be corrected through the hospitals and through the medical treatments. And the modern biomedical model of health relies on the following key assumptions. So these are the following are the major key assumptions of this biomedical model of health, and these are the important features of this biomedical model, or the modern model of health, which is more scientific in its context, which is more rational, and it is based on logical and observable evidence based on the scientific experiments and diagnostic tests. The results of the diagnostic test is basically the major evidence which will tell that whether a person is sick or whether the person is normal and healthy. Okay, now number one feature of this model is that illness or ill health is seen as failure of the body to function normally. So sickness is kind of a failure of a normal human body. Each disease is caused by a specific germ. So this biomedical model of health believes in the germ theory, and the germ theory states that any unhealthy situation or sickness is caused by an entity which can be a bacteria, which can be a virus, and that germ is basically responsible for that sickness. And in order to make the body more healthy and to recover and to regain its health, it is important to isolate and treat this germ, which is basically causing the sickness. Mind and body are separate, and they should be treated separately. So this is another assumption of this model, that mind and body are two separate things, and they should be treated separately. So it doesn't take a holistic view of the human body, rather human body is taken as a sick object in which the major focus is on the biological aspects of the sick body rather than on the psychological aspects of the sick body. Professionals develop a medical gaze, which is a way of looking at the patients in a neutral and a value-free and dispassionate way. So this in this model, medical gaze is also another important element or another important feature of this biomedical model of health. Medical gaze is basically a very neutral and a value free way in which the doctors, they do not associate with you emotionally, and they take you as a sick body, and their major function is to treat that sickness, and they have no emotional affiliation, no biases towards you, and they have a kind of a training to treat the body in a more neutral and a value free way. Information based on the medical charts and reports is more dominant over patients' subjective description of their illness. So again, the fifth important element of this biomedical model of health is that subjective feelings of patients are not given any importance. The medicines which are given to you and the treatment that is offered to you in this system is based on the logical as well as the scientific evidence, which is based on your diagnostic tests. If let's say, for example, if a patient is saying that I am diabetic, I'm having these symptoms, and look doctor, you have to give me the medicine of diabetes, but the doctor will definitely not give you straight away the medicines of diabetes unless and until they will go for your blood test, they will go for certain scientific tests, and they will obviously will declare you as a patient of diabetes on the basis of those tests. And if those tests are, let's say, they are saying that you are healthy, the doctor will not focus on your subjective explanation or your subjective experiences of sickness or health issues. So this is the fifth feature of this biomedical model of health. If you talk about the sixth quality of this system, then the patient's medical history should be compiled and kept in the forms of files. So there is a formal behavior, there is a formal attitude in order to maintain the history of the patient in proper files, and they must have their previous records when they go to the doctors and when they go to the hospitals. Only certified medical professionals can diagnose and treat the disease. So these certified professionals are not just normal and common healers, they are the professionals and they are the skilled people in this profession, and they have been through proper training, proper education, proper colleges and universities, and they have been through the entire process which is recommended and which is obviously which has been which has been taken as the appropriate way of getting properly trained. The medical professions has certain quota and only keeps those professionals who have gone through lengthy educational training. As we all know that they do get the training through different medical universities and colleges. There is a specific time period, there are specific examinations, and then they have to go for house jobs, and then they are declared as proper practitioners who can join different hospitals, and later on they go through different specializations in different fields. So this is how these professionals are different from common healers and common practitioners or healthcare quacks. This is basically another feature of this biomedical model of health. Only hospitals are the suitable environment where serious illness can be treated based on the facility of technology, apparatus, and pharmaceuticals. So these are majorly the main assumptions of this biomedical model of health, or we can say that these are the qualities and the major features of this biomedical model of health, and the biomedical model of health is based on all these characteristics. Now, this model of health has been criticized by many sociologists and many experts, and there are many criticisms on this model. For example, some of the historians they have pointed out that this model is taking away exaggerated importance, and there were many other there were many other changes, the social as well as cultural changes which were taking place along with this biomedical model of health that has actually caused increased in life longevity and reduced mortality rate and reduced death rates. So most of the importance is taken away by this biomedical model of health. However, it totally ignores other sociological as well as social and political and economic changes which were going on in societies. And these changes basically They are based on improved sanitation, sewerage system, individual hygiene awareness. So all these things were also having a strong influence on reduced infant mortality rate and improved life expectancy. So the health issues are also resolved to greater extent by the public health policies, including clean drinking water and all these facilities. However, we have seen that within, if you look at the history, so majority of the people, give entire credit to this biomedical model of health while ignoring all these social and economic changes which were taking place in the societies. So another criticism that is given to this, or that has been faced by the biomedical model of health, is given by Ivan Illich. Ivan Illich has given a very beautiful and a very tremendous theory by the name iatrogenesis, and this iatrogenesis is basically the side effect of biomedical model of health. And the iatrogenesis which he is talking about is mainly of three kinds: clinical iatrogenesis, social iatrogenesis, and cultural iatrogenesis. So if you talk about clinical iatrogenesis, then Illich is highlighting the side effects of going to hospitals and side effects of the medical treatments, and basically the major disadvantages which are associated with this biomedical model of health. For example, patients entering the hospitals for the treatment of pneumonia can get MRSA, or they can get corona, they can get COVID-19, or they can get other big bugs of the clinic. So in this way, when when they are going for very common diseases, they get caught by big bugs and big germs of the clinics and the hospitals. Okay, and then another example is misdiagnosis by the hospitals and misdiagnosis by the doctors. Maybe the patient is suffering from something else, but they are treated for a very chronic disease, and a very, strong medication is given to the patient, which he or she actually doesn't require. So again, one of the clinical iatrogenesis can include mixing up of patients' files and negligence on the part of the doctors that can be very much deadly for patients. So this is basically clinical iatrogenesis, that is related with clinics, that is related with the treatment that is taken by the patient within hospitals, the negligence that is shown by the doctors, and all these issues which are basically the side effects of the biomedical model of health. Okay, the next criticism that was given by LH was social iatrogenesis. Okay, now the social iatrogenesis is basically, if we talk about social iatrogenesis, it is also called medicalization. And when medicines expand into more and more areas of life, it affects our social, aspects of our daily life. It involves the process of medical intervention permeating more and more to the daily life practices of people, and later on, then. For example, if I give you an example of medicalization, then more medicines, more treatments, more expensive technologies, and even increasing healthcare cost is needed for the societies and individuals in order to maintain their health. So social iatrogenesis is another big issue and another big side effect of biomedical model of health. Okay, now the social iatrogenesis or medicalization can lead to cultural iatrogenesis. Cultural iatrogenesis is basically the outcome of social iatrogenesis, when people are almost unable to manage little challenges of their life. So they become kind of, the right word is that they develop unnecessary dependency on this biomedical model of health, and they develop a kind of a more kind of a social life and a cultural life which de-skills people, and they have no control over their bodies, and the ultimate control over their bodies is of this biomedical model of health, and the ultimate verdict about their health is basically issued by this biomedical model of health. So this is basically cultural iatrogenesis, in which we have an over dependence, we become over, dependent on this biomedical system, and our everyday life is influenced, and our everyday life practice is completely affected in for example, let's give you an example, that whenever we have a slight headache, we suddenly open up the medical bags, and we take two tablets, panadols, or anything else. So people have the you know this allopathic system and this biomedical model of health, it has penetrated into people's everyday life, and it has also affected their cultural as well as their daily social practices, in which it has de-skilled people, and there is an over reliance, and then there is an over dependence of people on this biomedical model of health. According to Illich, that because of all these reasons, the power and the penetration of this medical institution should be curtailed, it should be stopped, it should be limited, and the over we can say penetration of this system can be very detrimental to human health and their social as well as cultural lives. Now, there is another criticism on this biomedical model of health, that they are this biomedical model of health purely ignores the subjective feelings of patients, and it pays no attention to the subjective feelings of patients, and purely relies on the objective analysis and the results of the scientific tests. So patients are seen as sick bodies, and they are not taken as holistic individuals, and just a sick body is more important for the doctors, and for a complete cure, sometimes their overall well-being, the psychological, the emotional, as well as the biological are interconnected, which are usually ignored by the doctors. Finally, many people are rejecting the idea that the biomedical model of health is a better model, and they are relying and they are more focusing on the alternative medicine system, on the traditional medicine system, and the complementary medicine system. And with the passage of time, the side effects of this biomedical model of health are increasing day by day, and people are more diverting towards the alternative medicine care systems. So the growth of the alternative and the complementary medicine system is becoming legal as well as popular in many parts of the world. So this was it, and I hope that you people have understood the biomedical model of health. And as far as your final exams are concerned, I think that because of the ongoing global health crisis caused because of COVID-19, this topic is going to be extremely important. And for your ease and for your comfort, I have given lecture on this lecture so that you can on this topic, so that you can easily understand what biomedical model of health is and how important it is in this present scenario, in this present contemporary health crisis. So I hope you have a better understanding of the whole concept. So best of luck for your papers. Allah Hafiz.